or good evening, everyone. Thank you for joining. We will begin this shortly. John, you're good to go?
I'm good to go. Are we ready to record, Mr. Nick?
We're recording now. Go ahead.
Thank you, and welcome to the Youth COVID-19 Vaccine Town Hall, hosted by the San Francisco Department of Public Health, produced by the virtual outreach team of the COVID Command Center. Housekeeping. When this announcement finishes, language interpretation will be available in Cantonese, Spanish, Arabic, Vietnamese, and Filipino. To enable language interpretation, click the interpretation icon and choose the language channel that corresponds to your needs.
每位口譯員宣讀完口譯指令之後，主持人便會開啟口譯功能。如果需要收聽粵語、西班牙文、阿拉伯文、越南文以及菲律賓文嘅口譯頻道，請用鼠標點擊屏幕下方嘅即時口譯圖標，亦即係好似一個地球儀咁嘅圖標，然後選擇你所需要嘅粵語頻道，即可收聽粵語口譯。多謝。Finish。
Los servicios de interpretación en español estarán disponibles después de este mensaje. Para accederlos, haga clic en el icono de interpretación y elija el canal de español. Gracias. Ready.
لتمكنك الحصول على الترجمة باللغة العربية، اضغط على رمز الترجمة وثم اختر اللغة العربية لتمكنك بالمراسلة بوضوح وبإتقان أكثر باللغة التي ترغب بها. Finish.
Xin kính chào quý vị, để được nghe phiên dịch thông dịch tiếng Việt, xin quý vị bấm vào bên dưới màn hình có quả địa cầu, chọn Vietnamese để được nghe phiên dịch tiếng Việt. Xin cảm ơn quý vị. Finish.
Magandang gabi po. Meron pong interpretasyon sa wika ng Pilipino o Tagalog na available. Upang magamit po ang interpretasyon sa wika na yon, pindutin po ang tatak ng interpretasyon at piliin po ang channel ng wika na tumutugma sa inyong mga pangangailangan. Salamat po. Ready.
Housekeeping. Closed caption. To activate closed caption, select the closed caption button at the bottom of your screen. If you do not see it, click more or the arrow asterisk buttons at the bottom of your screen and then click closed caption.
Isara nyo ang closed caption.
Housekeeping, recording. Today's event is being recorded. Today's event is also being streamed live on YouTube, audio and video. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and videos disabled. Video will be on for speakers only. Q&A. To participate in Q&A, please select the Q&A button at the bottom of your screen to enter your question. Thank you again for joining us. If we recognize there may be members of the media joining us on today's webinar, we ask that media questions be directed to dempress@sfgov.org for follow-up. And with that, let me hand this to Anna Veladzik.
Thank you, John. Welcome, everybody. My name is Anna Veladzik, and I will be your moderator tonight. I am the team lead for schools and childcare at the San Francisco Department of Public Health. This event is being streamed live through the SFGovTV YouTube channel. There is a maximum capacity in this meeting of 1,000 people. So if you hear of others trying to get in but aren't able to, please send them to the SFGovTV YouTube channel. Well, we will be recording and be able to send out this video later. There are also other places where you can find a recording of this event, and we will email recordings out to all registrants after this is over. We are so glad to have you all join us tonight for a town hall for San Francisco families and caregivers to provide information and answer questions about vaccinations for youth and family members in San Francisco, with the focus on vaccines becoming available for 12 to 15-year-olds coming very soon. Again, if you need simultaneous interpretation, please select your preferred language through Zoom at the bottom of the screen. This feature is available through computer only, audio only, not by calling in by phone. You may want to choose the option to mute original audio if you don't want to hear the English language while you're listening to interpretation. We will also have recordings available in language after this meeting is over. We want to also remind the panelists not to speak too quickly so that our interpreters can please keep up. Thank you. We will be taking audience questions through the Q&A buttons, as well as through just through the Q&A button. We will not be using the chat function. We have the honor of having Dr. Mary Mercer, who is leading our vaccine team. She is going to be helping to answer questions in the Q&A function. We will try to respond to as many questions as possible, but we will email out the materials and websites to all that registered. I would first like to introduce our panelists for the evening. Would you each introduce yourself and what role that you have related to youth and family vaccinations? Let's start with Dr. Susan Phillip.
Thank you, Anna, and thank you to all who have helped organize this event, and thank you for everyone who is attending. My name is Dr. Susan Phillip. I am the health officer for the City and County of San Francisco. And my role is really in ensuring optimal health and safety for all in San Francisco, including our youth and families, and ensuring safety of youth and families, and also ensuring that we can all be back for full in-person instruction in the fall is one of my top priorities. So I'm glad to be with you this evening alongside my esteemed colleagues.
And next we have Dr. Lee Atkinson.
Hello, I'm Lee Atkinson. I'm a pediatrician and chief of the Division of General Pediatrics at UCSF Benioff Children's Hospital. And my role is we as pediatricians are partnering with the Department of Public Health to ensure children are safely vaccinated. And I'm here to speak with you in that role. Thank you.
Thank you. And last but certainly not least, we have Dr. Lillian Brown.
Thank you and good evening. My name is Lillian Brown. I am an infectious disease physician, and for the last 9 months, I have been leading a team within the Department of Public Health's COVID Command Center that supports and responds to cases within schools, childcare, and youth programs.
Thank you, everyone. Before we begin answering questions, we want to share some basic information on youth and family vaccinations. Katie, if you wouldn't mind, please bringing up the slides, and Dr. Phillip will begin the presentation.
Thank you so much. And again, thank you to everyone who is joining us. And we're so happy to be able to talk with you this evening about such an important topic, youth vaccination, and such a timely topic as this has been in the news just this week. Next slide, please. So this is my name and my title, as I have said earlier. Next slide, please. So we have in San Francisco, as everywhere in the country and the world, been going through such a difficult ordeal with COVID-19 for the past 15 months or more in some cases. Where we are now in San Francisco is a much better place than we have been previously in the pandemic. Right now, our case numbers or people getting infected with COVID-19 are very low in San Francisco. This is due to the power of the vaccines and their ability to prevent infections and keep people safe and healthy. We are in a great position compared to where we were when we were having one of our high surges of cases in San Francisco in January. And we are in a good position compared to other parts of the country and other parts of the world. Next slide, please. This is because of the vaccinations, but it really is because of many people like you and others in San Francisco who have stepped up, who have understood the science, have been interested, and have been willing to get vaccinated. San Francisco residents, in fact, have gotten vaccinated, have encouraged their friends and family to get vaccinated at some of the highest rates in our entire country. And we are now role models in the United States. We have over 75% of all San Franciscans who are over age 16 who have received at least one dose of vaccine, and 56% of San Franciscans over age 16 have completed their vaccine series and are fully vaccinated. Now remember, we are talking about the age of 16 because until this week, that was the age cutoff for being eligible to get vaccine. And that has changed just this week. When we look at the youth who have been eligible for vaccine, what we see is that 2/3 of San Francisco residents who are age 16 to 17 have received at least one dose of COVID-19 vaccine, and about 1/3 have completed getting vaccine. This is great news, and we want to keep it up as we extend the eligible age for vaccine down to 12 to 15-year-olds. Vaccines are the key that are going to get us through the pandemic. Next slide, please. I also wanted to set the stage for the amazing information that you are going to receive from my colleagues later in this presentation. But the bottom line is we are so excited to announce that youth age 12 to 15 can now also receive the COVID-19 vaccine. They can have the benefit for themselves and for their own health, to protect other members of their families and their communities. And we're going to be talking a lot more about those details. I want, however, to be very clear. All of the research and all of the experience around the country and right here in San Francisco reinforces that school reopening and having students be in person for school are not dependent on vaccination. We are able to have students back in class safely following the prevention measures that we have recommended to be in place. So vaccines are not required for school reopening, but they do help decrease the overall rates of infections in the city and allow us to open all of the activities that we enjoy and allow us to do many of the social activities, out of school activities, all of the things that we miss being able to do with each other. Vaccines for children and youth age 12 to 15 are going to be available starting on Thursday, the 13th, tomorrow, after the Western States Scientific Safety Review Committee, which is comprised of experts in California and other Western states, review the recommendations that have already come today from the CDC's Advisory Committee on Immunization Practices and were adopted by the CDC director just this afternoon to allow the Pfizer-BioNTech vaccine to be extended and given to youth who are age 12 to 15 years old. Many people are asking when the next group of children, the 2 to 11-year-olds, will also be eligible, and that is not expected until the fall later this year. However, we are going to focus on information for you all about the vaccine, about getting it for your youth that are age 12 to 15, and answer the questions that you may have. And next slide, please. With that, I'll turn it over to Dr. Atkinson for her expert review and assessment of the vaccines. Thank you.
Thank you, Dr. Phillip. So I'm going to talk a little bit about the vaccine. Next slide. So as you all know, vaccines are really important tools used in our society to protect against a variety of infectious illnesses. And the vaccines against SARS-CoV-2, which is the name of the COVID virus, they've used research that has been developed over the last 30 years and technology to understand how to develop those vaccines. In addition, they also had to go through the usual rigorous FDA and CDC review for safety and efficacy before getting approval under emergency use authorization. Next slide. So in the United States, currently, we have 3 brands of vaccines that are authorized and recommended for use. The Pfizer vaccine was approved today for 12 and older, the Moderna vaccine for people 18 and older, and the Johnson & Johnson, also known as the Janssen vaccine, available for 18 and older. Next slide. So talking a little bit about effectiveness. All 3 of those vaccines have been shown to reduce the risk of disease, hospitalization, and death from COVID. And real-world data shows that the vaccines are also effective against many of the newer virus variants that we've seen in the news. It is possible that some people after getting vaccine may get mild disease or mild symptoms of COVID-19, but they are protected against getting severe disease that might result in hospitalization or death. And we also see that rates of infection are going down quickly in countries that have achieved vaccination rates over 30%. And as we started this talk, one of the reasons that the rates of COVID in San Francisco are low is really due to the high success rate of our adult population getting vaccinated. Next slide. I know a lot of you have concerns about safety. So the main question around, is the vaccine safe or was it developed too quickly? Again, 30 years of research on how to make this type of vaccine for the type of virus that COVID is, was used to develop these vaccines. In addition, the vaccines went through the same regulatory standards as other vaccines, like MMR or DTaP or poliovirus vaccines. And when they did studies or trials to see if they were safe, the manufacturers made sure they included individuals from a variety of ethnicities. But like other vaccines, there are some side effects. And most of the side effects that we know about are relatively minor. There's pain from the injection. There might be swollen lymph nodes or glands, fever or chills, nausea, headache, fatigue or tiredness, or muscle aches that typically last 1 or 2 days after the vaccine. Severe allergic reactions are quite rare. And a lot of people are worried that the vaccine can cause COVID-19, but that is not possible because there is no live virus in any of the vaccines that are available. Next slide. So who should get vaccinated? Is everybody 12 and older is now who's eligible. Who shouldn't get vaccinated is anyone who has not reached their 12th birthday, so you're not old enough to get vaccinated. You've had a severe allergic reaction or anaphylaxis to the first dose of the vaccine, or you consult with your doctor or your child's doctor, and they tell you that you have a medical reason to not get the vaccine. And I want to point out that medical reasons to not get the vaccine are very, very few. If you're pregnant or breastfeeding, make sure you check in with your doctor before getting a vaccine. If you're taking medicines that might suppress or make your immune system not react as well, you should also talk to your doctor. And if you've had a history of a severe allergic reaction to another vaccine or some other injectable medication, you should talk to your doctor before getting the vaccine. Next slide. And I want to turn it over to Dr. Lillian Brown.
Thank you very much. I am going to talk about COVID-19 in the school setting and the potential impact of vaccination. Next slide, please. First, I want to address school safety in the setting of COVID. Are schools high risk for COVID-19? The short answer is no, particularly when following the guidance from the Department of Public Health. On the right-hand side of the screen is data on cases of COVID-19 in K through 12 schools that were open for in-person learning between September 2020 through February 2021. Even before anyone in this population had access to one of the highly effective COVID-19 vaccines, there were very few cases in a school setting. Notably, out of almost 20,000 students and teachers and staff who were participating in in-person learning over these 6 months, there were fewer than 5 cases that were actually acquired in school. Teachers and staff became eligible for vaccination at the end of February. Vaccination rates have been extremely high in this group, exceeding even the rates shown by Dr. Phillip earlier. Since then, cases have essentially been eliminated in this group. And currently, what we are seeing in a school setting is cases related to transmission from unvaccinated adults in the community. Next slide. So it is great news that 12 to 15-year-olds are now eligible for vaccination. It is a way for them to protect themselves for their own health, and we anticipate it will decrease cases in schools even further. In addition, ensuring all eligible youth and their family members have both the information and access they need to get vaccinated will protect their household and the community. Next slide. So one of the most common questions is, now that 12 to 15-year-olds are eligible for vaccination, where can they get vaccinated? And you can see on this slide the number of sites throughout the city that are offering vaccination for age 12 to 15-year-olds starting tomorrow.
Thank you, Dr. Brown. We will now spend the remainder of our hour answering questions that were pre-submitted and those that we have received live tonight on Zoom through the Q&A box. We have volunteers gathering all of these tonight, and we will get to many of them as we can. If we don't get to yours, we hope to still get you the answers over the next week or so, and post all of the answers either through an email through the attendees and send out the appropriate websites that have all of the right information. So for our first question, it is for Dr. Brown. And the question is, with 70% of San Francisco vaccinated, why is it important now to get my 13-year-old vaccinated? Can we wait? What is the importance on the larger San Francisco community?
Thank you for that question. I think that that is a really good question, and probably a lot of people have that question. We have done very well as a city with our vaccination rates, and our community rates are currently low. I will go back to my last slide and just emphasize that the vaccine will protect your 13-year-old and will also protect the younger children that your 13-year-old may interact with on a daily basis, and the rest of the household. So that's one reason at a sort of individual and household level to get vaccinated. And at the community and city level, you know, the fewer residents in our city who are able to get infected, the more the entire city is protected.
Great, thank you. The next question is for Dr. Phillip. We actually have a set of questions that are all related, is on how to get the vaccine and if there are requirements. Also, if 12 to 15-year-olds will be prioritized into groups, with those that have health issues receiving the vaccine first.
Thank you for those questions. And what is really good news is that right now we, unlike at other times during the pandemic earlier this year, have adequate vaccine supplies. We have vaccine in San Francisco to provide to youth that need it, both those that might be at higher risk if they become infected with COVID-19 and youth that don't have any health problems. So that is great news, first of all. There are a variety of ways that you can access a vaccine. Neighborhood pharmacies may have access to be able to provide vaccine. There is the slide that we had up earlier where you can go to the San Francisco SFGov website, Get Vaccinated, and see the sites that offer the Pfizer vaccine, which is the one that is authorized for youth age 12 to 15. And so there are a variety of ways. And in some neighborhoods, we also have access points, community access points for vaccine as well. So there are a variety of ways to get vaccine. And again, the good news is that we want to be able to provide vaccine, and we believe we can provide vaccine for all of the youth in San Francisco in this age group. So please do look at the list that was put up in the slide and will be sent out to you, and you'll be able to find an option that would work for you and your family.
Dr. Phillip, we have two more questions for you. The first one is, do we get the shot through our insurance provider? And what if we do not have insurance?
These are also excellent questions. You may be able to get insurance through your usual healthcare provider, through your child's pediatrician or your family doctor, or the health system where you usually get care. There is no cost to you to get this vaccine for your family, for your child, or for yourself. So there's no cost associated with doing that. If it is more convenient for you to get the vaccine at a local pharmacy, a commercial pharmacy, or to get it at one of our vaccination sites that the city is helping to run, those are also options for you. So there are lots of options for how to get vaccine. And on our website, there are lists of different places that will offer the vaccine and be able to accept appointments and see youth age 12 to 15 starting tomorrow.
Another question for you, Dr. Phillip. Can a minor consent to getting the vaccine if parents do not want them to? And what identification will be required?
You know, we have always said that we do not want identification to be a barrier. And so we will work with youth and families to ensure that everyone has access to vaccine. That is our top priority. So documentation and identification will not be barriers to providing vaccine. We want families to be able to be informed about vaccine and to make decisions. And additionally, we don't want, as I said, barriers to getting the vaccine. So we will have multiple ways in which families, which parents and legal guardians are going to be able to help ensure that youth can get the vaccine. They can either come with the youth in person to get vaccine. There are ways in which they can send a form if they have to work and they're not able to accompany the youth. They can give consent over the phone. And in some rare instances, youth may also be able to consent themselves. In most situations, if a family member, if the adult parent or legal guardian do not want the child to have the vaccine, then there would be a conversation between the vaccine provider and the family to talk through that decision. And we do always want to respect the wishes of the individual youth and the family member. So we would try to talk through that and be able to provide what information would enable the family and the youth to make the right decision for themselves.
Great, thank you. Dr. Atkinson, the next questions are for you. We have gotten a number of questions on safety and side effects. There are a number of questions about whether children with pre-existing conditions or allergies should receive the vaccine. Conditions noted include epilepsy and food, egg, or latex allergies, and those that are immunocompromised. So can you please address whether these children should consider getting vaccinated?
Thank you for that excellent question. One of the things that I want to sort of emphasize is early on in December and January and February, when the vaccine was first becoming available, we tried to actually target high-risk populations, such as the ones that you described, to ensure that they got their vaccine. Some of those individuals are at higher risk to get COVID-19, the disease. So we would say for patients with asthma or environmental allergies or epilepsy, they should get the vaccine. If you wanted to be cautious, you can call your provider and talk to your provider, who is a specialist who provides care for that disorder, to get their input as well. For patients whose immune system isn't working well, we would need to understand where your immune system was in the course of your disease. So that's another reason to make sure you check in. Some of the concern isn't that the COVID vaccine necessarily would make you sick, but if your immune system isn't functioning well enough, you might not make the necessary antibodies and T cells to help protect you from getting sick.
Thank you. We have a follow-up question. What options are there for people who may not have access to a primary care doctor, but have questions, or a part of the population where a primary care doctor follow-up is recommended, but they do not have access to such doctor?
So in San Francisco, we are a safety net city in our approach to primary care. So if you don't have established relationships, you can establish a relationship now. We have the Community Health Network that offers care. UCSF has primary care clinics. Sutter has primary care clinics. And so you should be able to call and find a provider with whom to establish care, which we recommend you do for multiple reasons besides this. In addition, at sites where vaccines are given, they oftentimes will have somebody, including in pharmacies like CVS or Walgreens, to answer any questions that you might have specifically about the vaccine.
Great, thank you so much. The next question is also for you, Dr. Atkinson. I have a 12-year-old who recently started her period, and recently I have heard many anecdotal reports of women having menstrual irregularities post-vaccination. Has this been studied? Can you speak to this?
So from the onset of starting your period or menstruation, and for the following several years, up to 5 years later, it is well known that girls can have irregular periods for a variety of reasons. They can have irregular periods from the way their cycles work, from stress, from getting sick. We've seen reports of irregular periods in adolescents who've been diagnosed with COVID. And so we've now heard reports, and it's been in the media, and my 17-year-old daughter who got her vaccine said she saw on TikTok that was something she should look out for. So I know it's out there. When they were studying the vaccine, if you recall, they studied it in a largely adult population initially to look for this. And as they've added on studies in younger people, they're looking for the side effects. But this has not been a commonly reported side effect enough for us to know that this is caused by the vaccine, that it is something more than a change in the cycle due to the fact of the stress of having undergone a vaccine, and if you had a little bit of a side effect in response to it. So in the United States, we have a system to collect data on every single side effect or event that happens. And I encourage you, when you get your vaccine, to sign up for that and report those things that you see. You can report it directly there's lots of apps. You can let your physician know for us to keep track of it. So we're aware of those reports. It has not been shown to be causal. And so we will just have to continue to track that over time.
Great. Thank you, Dr. Atkinson. The next question is for Dr. Phillip. Do we see the vaccination for COVID-19 becoming mandatory for students to attend school, such as other vaccines? And if so, when will that happen?
Well, what I can say to that is not a determination or a mandate that we are going to make in San Francisco in isolation. Right now, the vaccines for adults and for youth are under an emergency use authorization. And so there is a process which has just happened for the manufacturers to submit all of their accumulated data to get full approval for the vaccines. And we expect that that step would be necessary. We also believe that this will be a statewide conversation and decision, not at the level of individual cities or schools. So there's no plan as of now in San Francisco, and no plan that I know of statewide, but we may be hearing more about that discussion in the coming months.
Thank you. Dr. Phillip, this next question is for you. Actually, it can be shared with Dr. Brown or Dr. Phillip. Will children who are vaccinated be exempt from face covering health order once they are fully vaccinated? Will the requirements to get COVID tests for asymptomatic screening at school be adjusted for those who are vaccinated?
Dr. Brown, maybe I will start. And since you have really been the expert working so closely with the schools and with investigations, I know you'll have something to add. What I will say as health officer is that our goal is to continue, as our cases stay low, to be able to remove our masking requirements. And particularly for vaccinated people, we know that there are increasingly going to be opportunities for them to go without masks safely, to potentially reduce distance between themselves and others safely. And we've seen this in San Francisco as we have removed our requirement for masking outdoors in the majority of situations. This will apply to youth age 12 to 15 also. So they will get the benefit of the changes that are already starting to happen. And we expect that we'll get more changed guidance from CDC and the state as we consider in what situations we might remove masks indoors as well. So there is a real advantage to being vaccinated for all of us, not just the youth, but the youth will have that additional benefit of being able to potentially remove masks and feel more comfortable doing that, and to be able to do it safely with their peers, which I know has been a big area of focus for many families and youth wanting to be able to do that. And Dr. Brown, I'm not sure if you have anything else that you'd like to add in your experience to that as well.
Thank you, Dr. Phillip. I will just echo everything that Dr. Phillip just said, and also hit, I think the second part of the question was around testing requirements, and that requirement has already been removed for vaccinated teachers and staff, and we would anticipate that this would apply to vaccinated students as well.
Thank you. Dr. Atkinson, the next question is for you. For how long will the vaccine provide immunity, and will there be a third shot?
Excellent question. For right now, we don't know, but it is something that the manufacturers of the vaccines are sort of looking into. And I think one of the things that determines it is the existence of variants, and if more variants develop that are resistant, whether there would need to be an additional shot to provide protection against that. And the other issue is, as the virus is new, we are also learning as we vaccinate people as we go how long effectiveness is. But for right now, there isn't an anticipated booster dose or extra doses that are being predicted.
Thank you. Dr. Phillip, the next question is for you. Which children can get a vaccine in San Francisco? So for example, do you have to live in San Francisco if a child is a student in San Francisco but lives in another county? May they get the vaccine in San Francisco?
You know, all throughout this pandemic, I think this is a really important question, so thank you for bringing it up. Throughout the pandemic, we have said that people that live or work in San Francisco are eligible for vaccine, and my understanding is that we will extend that as well to youth. So if this is the place where youth go to school, if this is the place where they get their care, if this is the place that they spend their time, whether or not they actually have an address in San Francisco, we are welcoming you to come to our care sites, to our pharmacies, and get vaccines. So our main goal is that we want as many youth that live in San Francisco, that are coming into San Francisco, to get vaccinated as possible, because as my colleagues have said, that is how we will protect all youth and everyone in the city as we are continuing to loosen our restrictions, continuing to open up, and trying to get back to the activities and the behaviors and the settings that we all miss so much.
Thank you. This question is applicable to all three of our esteemed doctors. Who is paying to make these vaccines free? And what is the incentive for the health department and schools to allow these to be free? Anyone would like to take that?
Well, I will start, and I do think that the three of us will probably have slightly different perspectives and can add something to the answer. I think that this gets at an important point. What is the motivation behind our recommendation? Why am I, as health officer, so enthusiastic about these vaccines? And I think the answer for me is I don't have any conflicts of interest. I don't have any stock or vested interest in any of these manufacturers. What I do have a vested interest in, and what I have sworn to uphold, is the health and safety of everyone in San Francisco. And what we have seen in all of the places around the world where these vaccines have been used is how remarkably they save lives, keep people out of the hospital, and allow society to function again in ways that we haven't been able to in 15 plus months. So that is my motivation. And the reason that they're able to be free is because our federal government and state government, and we here locally, have invested and have put the funds into these efforts in order to be able to open our city up again, and to be able to have families be able to interact again, and to keep people from dying, quite frankly, in San Francisco. So that the source of funding is from the government and has been. So there is a lot of federal money that is going in towards delivering these vaccines and making them accessible to the American people. And we are part of that effort here in San Francisco. And I'm sure my colleagues will have other really wise things to add to this conversation as well.
Dr. Atkinson or Dr. Brown, would you like to add?
I want to highlight everything that Dr. Phillips said. I think having lived through and witnessed the last almost year and a half now, the loss of life, the harm that we've all sustained moves me as a physician, where part of the reason you go into healthcare is to help people stay safe and help people to thrive, and particularly in pediatrics, helping kids grow and develop. And we know that they've not been in a situation where they can grow and develop, even if they don't mind being at home for distance learning. Their teachers have been stressed and stretched. They've not been able to engage with others in activity. So being able to have this as a glimmer of hope to allow us to return to what we agree are normal developmental ways of being, I think is really, really critical.
That was
Dr. Brown?
so well said by Dr. Atkinson and Dr. Phillip. I'll share a little bit of my motivation as an infectious disease doctor and as a parent. I wanted to do what I could to support children and families in the city. And I have never been as hopeful as I was in the last 15 months as I was on November 9th when I saw the first results from the clinical trials of the COVID-19 vaccines in adults. And that hope has just continued throughout the spring as we have seen how many lives they've saved, how many hospitalizations they've prevented, and how much pain in families here in the city and across the country these vaccines have averted. And I have no financial conflicts of interest. I just want to support children and families.
Thank you, doctors. This next question goes back to the issue of authorization. Excuse me. The question is, and I think it will start with Dr. Atkinson, wouldn't it be safer to wait for a full FDA approval for children? And the follow-up is, long-term impacts have not been studied. Should we be concerned?
So I just want to clarify, the emergency use authorization does involve a really careful attention to safety. And so it does not mean that there was corners cut or we didn't look at things. If you think about this last week, we all knew, we saw it on the news, that the FDA was going to look at the vaccine for 12 to 15-year-olds. But we still had to wait. The committee still had to meet. They still had to check the data, check the studies, look at the outcomes, and really confirm the safety based upon what we know. The same was done by the CDC Committee on Immunization Practices. They didn't just, FDA said yes, we will say yes. They had to go through their process of their experts looking at it to make sure that it was safe. The emergency use authorization really takes out of the process a few of the steps that are typically built into how the FDA approves things that makes it take a longer time. And the second piece is, this is all new to us. You know, I think to myself, 2 years ago, if you said COVID, like all of what we've experienced as healthcare professionals, we didn't know. I didn't learn this in medical school. I didn't learn this in my 20-year career. We all last March had to learn and read and know and understand, what is this virus? How does it affect us? What do we do to support patients who have it? And so some of the fact that this is approved under that approach is because this is all very new, and the virus is changing a little bit. So those variants that make it resistant, we know the effectiveness based upon the existing virus that is around. But it is not because corners are cut on safety. It is because the approach of how you approve things just happens differently when we needed them to do it quickly.
Thank you, Dr. Atkinson. This question is actually for everyone. How do I talk to a young person that is hesitant to get the vaccine?
Well, I do this quite often. Sometimes I have parents who come in and they're like, yep, we're ready to go. And the child is old enough to have an opinion and they say no. So since we have been alive as humans, there are viruses and bacteria that can infect us and cause us to get sick. And the process of vaccination was discovered as a way to help prevent that. Vaccines are carefully studied. Anything that's injected into the human body has a rigorous way of looking what the side effects are, what is it going to do to you. And what we also know is, even though the rates in San Francisco are low, they're not zero, right? I think it was 26 people today tested positive for COVID, were just diagnosed with COVID. And so doing nothing, not getting the vaccine when you're eligible, isn't necessarily the same thing as being safe. So I point that out as it's not, if I don't get the vaccine, I'll be perfectly okay. But if I get the vaccine, I might have a side effect, or it'll hurt me, or I'm worried about it. So, it's talking about sort of risk and benefit, and especially 12 to 15-year-olds, many of them can sort of understand that discussion. And oftentimes what I think is most persuasive is my 13-year-old and my 15-year-old will get a vaccine as soon as I can do it. I wasn't able to sign up before, but like the rest of you, Thursday morning, I'm going to be up early trying to make sure that they get a vaccine. So it is not only something that I think is right and safe for them, but it's also something that I would have my own children receive.
And as a follow-up, we have many people asking, why should we give the vaccine to children when they do not get very sick from COVID? Can you comment on this, please?
I think Dr. Brown may have talked about it a little bit earlier. So children are less likely to get very sick, but not immune from getting very sick. And we don't know which child is going to be the child who ends up getting very sick. So there is still a possibility, even though it's less than my chances, it's still out there. So that's one important reason. The second important reason is there might be others in your family for whom it is important that the child be vaccinated. Infants, nobody is studying the vaccine in the 0 to 6 month age, right? So if you're exposed to an infant, a baby, they don't have a way of getting protection. There are people in our society whose immune systems are just not well enough, or they have a reason they can't get the vaccine. We might inadvertently be exposed to those individuals as well. So it's a really important part of being a good citizen, a good member of the community, is to get those vaccines to really not only protect ourselves, but protect our most vulnerable out there.
Thank you, Dr. Atkinson. You have one more question. Is there a difference in the dose for the 12 to 15 age group versus the 16 and older age group?
It's the same dose. Some of what's taking it a little bit longer in the 2 to 11-year-old is really looking at, should it be a different dose? So that's why they're going to take a little bit longer. But for the 12 to 15-year-old, it's the same dose.
Thank you. We are getting a number of questions. People are asking to see where families can locate when they can get their 12 to 15-year-olds vaccinated. So I am actually going to ask Katie to bring up our last slide with the list of vaccine sites and how to sign up. If Katie wouldn't mind doing that while I ask the last round of questions. It is now 7:55. We do have 5 minutes left in our town hall, but we have one question for all of our doctors while we are displaying how people can sign up. And as a reminder, I will emphasize that this highlighted website is how you can sign up for vaccines in San Francisco. And and it just went away. And that will get you to schedule an appointment. So while that slide is coming up, this last question is for all of our esteemed doctors, is will you be allowing your children to get the Pfizer vaccine? And would you hesitate at all about doing so?
I can go first because I already said I have 3 children, a 17-year-old, a 15-year-old, and a 13-year-old. I got my 17-year-old, she was 16 at the time, the Pfizer vaccine as soon as she's a 16-year-old, so I had to wait till she was eligible, but I got her the vaccine and she's received it. And I'm hoping to get my 2 boys vaccinated this weekend. My nieces and nephew who are old enough, they've received the vaccine. I believe I would have taken Pfizer. I got Moderna as my vaccine because, you get the vaccine that they have for you when you show up. I think it's really important around safety, and I endorse it. Anybody who asks me, anyone who's my patient, I would say, get the vaccine.
And for me, my sons are 9 and 6, so I am anxiously awaiting the next round of approvals. And in the fall, I will certainly be taking them to get vaccinated as well. And as Dr. Atkinson said, the risk is not zero. And I don't want to take that chance with my 2 boys when there was a safe and effective vaccine that could have prevented severe illness.
I have 2 children who unfortunately are not old enough to be vaccinated yet. I strongly believe in the safety and effectiveness of this vaccine, and as soon as they are eligible, I will be taking them to get vaccinated, whether it's at their pediatrician, one of the city sites, or a pharmacy.
Thank you. We are at the end of our time, so we will have to say goodnight. We want to thank all of our panelists for making the time to be with us tonight, as well as our hosting partners, which is the Department of Public Health, the Department of Children, Youth, and Families, and also a major shout out to all the people behind the scenes, that helped to make tonight run smoothly. It was a major thank you. We know there are so many more questions that we had time to answer. We will work to get these answers to these questions. We have saved them all in the chat, and then we will share that information through our organizations. You will also be able to find a recording of this meeting at SFGovTV YouTube channel after this is over. Thank you again for being here, and good night.